All right, everyone, welcome back. Ready for another deep dive. Today, we're tackling the OSCE, that exam that looms large for all budding ophthalmologists.
Straight into the point. I like it.
Yeah, no nonsense, just packed with tips and tricks. And what's really interesting is it's not just about knowing your stuff, the medical side of things.
Right.
It delves into these soft skills, almost like a psychological game plan to really nail the exam.
Those subtle aspects can make a world of difference.
Absolutely. So let's jump right in. Pre-exam prep, where do we even begin?
Well, I think the guide hits the nail on the head with the basics.
Okay, so get plenty of rest, dress sharp, the usual suspects.
Exactly. But then it takes it a step further, this idea of practicing those examination routines.
Until they're second nature.
Yeah, like you've done them 1,000 times.
Because in a way, you have. Right. That's the point of practice. Walk in that exam room feeling like, okay, I got this.
It's all about that confidence.
Speaking of confidence, the guide goes into what examiners are really looking for, and it's a relief to hear. They're not expecting you to be a subspecialist already.
No, not at all.
Like, they don't expect you to know every rare condition out there.
Right. They're looking for a safe, competent general ophthalmologist.
Someone who can handle the common stuff.
Someone who has that strong foundation.
Okay, good to know. So breathe easy, everyone. It's not about showing off specialized knowledge yet.
Focus on those core principles.
Now let's move on to equipment. The guide gives a list, pretty standard stuff, but there's this one little detail that stood out to me.
Okay, I'm curious.
2 pen torches.
2. Why 2?
Right. It sounds a bit much, but when you think about it...
Backup.
Exactly. What if one fails?
You don't want to be caught off guard.
Absolutely. I love that. It's like, be prepared for anything.
It shows a certain level of
preparedness, and I think that ties into another point the guide makes about having a friendly, confident demeanor.
Oh, absolutely. It's not just what you know, but how you present yourself.
It's about walking into that room and showing them you're ready.
That you're comfortable in this environment.
Okay, so we've covered pre-exam jitters, what the examiners are looking for.
And that all-important backup pen torch.
Right. Now, let's get into the heart of the OSCE, examining the patients.
That's where the rubber meets the road.
Exactly. And the guide stresses, treating patients with respect, communicating clearly, making sure they feel at ease.
Right. You're not just examining an eye, you're interacting with a person.
Absolutely. And then there's this tip that I found a bit surprising. Don't ask for feedback during the exam.
Interesting. Why is that?
Well, the guide says it can break your flow.
Ah, I see. It can make you start second-guessing yourself.
Yeah, and you lose that confidence you've built up.
Makes sense. Trust your training. Stay focused.
So present your findings clearly at the end, but hold off on those questions until then.
Okay, so when it comes to presenting findings, any specific structure we should follow?
The guide recommends this 3-part approach. Describe what you see, give your diagnosis or differentials if you're not sure.
And then outline the next steps in managing the patient.
Exactly. It's about showcasing your clinical reasoning skills.
Showing how you think, even if you don't have all the answers right away.
Because sometimes you won't get that diagnosis spot on.
But the way you approach the problem can be just as important.
Okay, that's reassuring. So organization is key. Now, the examiner questions. Any advice on how to handle those? They can be a bit nerve-wracking, right?
Oh, absolutely. But the guide has some great pointers. Active listening is crucial. Really make sure you understand the question before you answer.
Sometimes I'm so nervous I jump in before they've even finished.
I know, right? But taking that moment to process, it shows you're thoughtful.
And it helps you formulate a clear response.
Exactly. Don't be afraid of those brief pauses.
They can be powerful.
Then, when you do answer, be clear, concise. Maintain eye contact. Project that confidence.
Confidence is key. Now let's talk about those moments when you feel like you're completely bombing the exam. We've all been there, right?
Oh yeah, that feeling of panic.
Like, oh no, I'm gonna fail.
But remember, everyone's going through it. The guide makes this great point. Those difficult cases, they're probably challenging for everyone.
Okay, that's good to remember.
And sometimes, those really tough questions, they might actually mean you're doing well.
Wait, really? Explain that one to me.
Think of it this way. The examiners are pushing you to see how far you can go.
Oh, interesting.
They're testing the depth of your knowledge, not necessarily trying to trick you.
So it's not always a bad sign if they're grilling you.
Not at all. They might be impressed by what you've shown so far.
That's a much better way to look at it.
So, when you hit that wall, don't panic. Take a breath, gather your thoughts, and keep going.
You got this. Each station is marked separately, so even if one goes a bit sideways,
Don't let it derail you.
maintain that energy, that focus, and move on to the next one. All right, so we've talked about handling those curveball questions, keeping our cool when things get tough.
And remembering that those challenging moments might actually be a good sign.
Right. Now, let's dive into a topic that might seem a little counterintuitive, but the guide emphasizes it. Avoid providing a running commentary during the patient exam.
Oh, you mean like narrating every single step?
Exactly. I guess it can be tempting to try to explain your thinking out loud.
To show the examiners you know what you're doing.
Right. But the guide suggests that it can actually disrupt your flow.
Ah, I see. It can make the examination less efficient.
Yeah. And you might end up talking more than examining.
Makes sense. So let your actions speak for themselves.
And then deliver a clear and concise summary of your findings at the end.
Okay, that makes sense. Now let's address the big one.
Yeah.
What happens if you make a wrong diagnosis? It's a scary thought, right?
Oh, yeah. It's like the ultimate nightmare scenario.
But the guide reassures us. Even if you miss the mark, a well-structured presentation can still earn you points.
Okay, phew. That takes some of the pressure off.
Because, let's face it, even experienced ophthalmologists don't always get it right every time.
It's human to make mistakes.
And in the OSCE, it's not just about that final diagnosis.
It's about the process.
Exactly. A structured approach shows your thought process, how you analyze information.
So even if you stumble on the diagnosis itself,
You can still demonstrate those clinical reasoning skills.
which are ultimately what they're looking for.
Absolutely. The guide also makes a great point about the language we use with patients. We need to be mindful of terms that might be insensitive or outdated.
Oh, that's important. It's not just about the medical knowledge, it's about that human connection.
Right. It's part of that professionalism that we talked about earlier.
So the OSCE is really testing us on so many levels. Medical knowledge, communication, patient interaction.
It's a holistic assessment.
Okay, so clear and respectful communication with patients is essential. Now, what about communicating with the examiners? Any tips on that front?
The guide stresses the importance of maintaining eye contact, speaking clearly and concisely.
Just like with patients, those nonverbal cues matter.
Absolutely. And if you need a moment to gather your thoughts, take it.
That power of the pause again.
It shows that you're considering the question carefully.
And it projects that sense of composure and control.
Right.
Okay, so we've got active listening, clear communication, and those strategic pauses.
All key elements of a successful OSCE encounter.
All right, before we wrap up this first part of our deep dive, I want to touch on something that can really throw you off during the exam.
What's that?
When an examiner seems to challenge your answer, you know that "are you sure" moment?
Oh yeah, that can be intimidating. It makes you doubt yourself.
Exactly. But the guide offers a helpful perspective on this. They say it's often a tactic to test your conviction, your ability to defend your reasoning.
Ah, interesting. So it's not about blindly agreeing with the examiner.
No, it's about demonstrating that you've thought things through.
And you can articulate your rationale.
So it's a professional dialogue.
Right. Of course, if you realize you've made a mistake, acknowledge it and retract your statement. But if you're confident in your assessment, stand your ground.
Explain your reasoning clearly and confidently.
It's about finding that balance, being open to feedback while also advocating for your clinical judgment.
And that ties into the bigger picture of lifelong learning in medicine. We're always refining our knowledge, adapting to new information.
Exactly. Even the most seasoned physicians are constantly learning.
And it's okay to not know everything.
Absolutely. Admitting when you're unsure is a sign of intellectual honesty.
And it creates an opportunity for teaching and collaboration.
Rather than trying to bluff your way through.
So those "I don't know" moments can become learning moments.
Precisely.
All right, before we move on to the next part of our deep dive, I want to circle back to something that really stood out to me in this guide.
What's that?
The emphasis on soft skills. It's not just about the medical knowledge. It's about communication, professionalism, patient interaction.
It's all part of being a competent and compassionate ophthalmologist.
Absolutely. And speaking of important details, let's not forget about that little nugget about bringing 2 pen torches. It's such a seemingly small thing, but it perfectly encapsulates the level of preparedness this exam demands.
Right.
So as we transition to the next part of our deep dive, I want to leave you with this question. What other seemingly small details do you think could make a big difference in your OSCE performance? Think about it. We'll be back in a moment to continue exploring the OSCE.
Looking forward to it.
Welcome back, everyone. Hopefully you've had a moment to ponder those little details that can make a big difference in the OSCE. Okay, so to our listeners out there, what are some small details that you think could give you that edge? We've talked about the backup pen torch, taking those centering breaths, even just offering a patient a reassuring smile. What else?
What about having a designated pouch or a small bag for all your equipment? It seems minor, but fumbling around for the right tool can really break your flow.
Oh, that's a good one. Efficiency is key.
It makes you look more organized, more professional.
And it saves time, too, which is precious in the OSCE. Anything else come to mind?
Well, think about your posture, your body language. Standing tall, making good eye contact.
Projecting that calm, confident energy.
Exactly. Even a firm handshake when you greet the examiner can make a difference.
It's all about those first impressions, setting the right tone from the start.
Oh, and here's another one.
Yeah.
Those transitions between stations. Make sure you're organized, gather your things quickly and efficiently, and move on to the next station with purpose.
Like you're on a mission.
Right. Don't waste any time. And finally, remember the power of a positive attitude. Even when you encounter a tough case, maintain a positive demeanor. Be willing to learn from any mistakes.
It's all about seeing those challenges as opportunities to grow.
Exactly. And remember, the examiners are there to help you succeed. They want to see you showcase your skills and your knowledge.
The OSCE is a challenging but incredibly rewarding experience.
It's your chance to shine, to showcase your skills, your knowledge, and your passion for ophthalmology.
Okay, so we've pretty much covered it all, haven't we? Pre-exam prep, handling those tough questions, presenting findings, and even the importance of soft skills, which is often overlooked.
Yeah, I think we've given our listeners a lot to think about.
So, to all of you aspiring ophthalmologists out there, remember, success in the OSCE is about so much more than just the medical facts. It's those small details, that preparedness, professionalism, and confidence that can truly make you stand out.
And bring those backup pen torches.
Always be prepared. And with that, we're wrapping up our deep dive into the OSCE. We hope you found it helpful and maybe even a little bit fun. Remember, you've got this. Go out there and ace that exam.